My name is Celia Wcislo, and I'm testifying today on behalf of the Service Employees International Union. Chairman Miller, members of the committee, SEIU applaud you for your draft bill that was released last week. I'm a local and national officer, as well as a board member of the Connector, which is implementing healthcare reform in Massachusetts. First, Americans are ready to fix healthcare. Have no doubt about it. And your draft bill includes many of the essential elements that will start that fix today. SEIU supports a robust health insurance exchange. That's what I do on a regular basis as a Connected Board member. And we found three very good reasons for it. One, it's allowed consumers to compare and find insurance plans all in one place so they have some choice and they understand their choices. Secondly, we built on our Medicaid program, so as people move off Medicaid into subsidized care or into the employer market, they have a path through which they can go and they can call one place to find out what they're entitled to. And finally, we have set a minimum standard of what health insurance is, which has protected our markets and models what you were going to do in the advisory committee. SEIU supports the public health insurance option in your bill as a way to keep costs down and foster price competition in the private market. While the Connected Board has been very effective in providing subsidized care to the low-income folks, we do not have a model of how to intervene in the private market, and I believe this approach will do it. It could pool the cost for small employers and individual folks in the market. In our state, when we did that, it saved 30 to 40% for individuals who are forced to buy it on their own. One way of addressing some of the concerns about unfair competition that I heard today is to make sure that the public plan pays rates equivalent to Medicare or a little higher. In particular, I'm concerned that Medicare does not pay as well for primary care, and you would have to look at that. But that would level the playing field because it will provide a closer to a single, a joint payer system where people are each paying the same amount and will limit the amount of shifting onto the private insurance premiums. SEIU supports the setting of minimum benefit standards. The Connector sets such standards for our health insurance, and we applaud the House for this proposal in this bill. Our standards have been critical to keeping the floor from dropping out of our insurance market and have protected consumers from predatory insurance companies. We also support the 400% affordability scale. Our scale stops at 300%, and clearly 60,000 of the people who are waived out of our individual mandate were waived out because they could not afford it. Your bill fixes that. And finally, we support shared responsibility. Employers, individuals, and the government must all do their part to make it a sustainable and affordable system that covers everyone. Massachusetts reform continues to be successful for many reasons, but I would say the major reason is the approach of shared responsibility that the House Tri-Committee bill adopts. We have an individual mandate. We have government support, and we have an employer mandate, and it has worked. And in fact, a recent study by Health Affairs by Bob Blendon showed that people the public more likely supports any kind of change in healthcare if all of us chip in, and they're more resistant if it only falls on individuals. Our individual mandate and our employer mandate have worked, and 70% of our residents still approve of the reform. SEIU applauds your proposal to make employers continue paying. One of the representatives mentioned Tennessee. There was no pay-or-play system in Tennessee, and employers I would not like chose to dump it onto the backs of government. I think we need to keep the monies that the employers put into the system in the system, and your pay-or-play idea would do that. To date, those two combined approaches in Massachusetts, an individual and an employer mandate, appear to have worked. We have 440,000 people out of 650,000 insured in less than 3 years. That's pretty amazing. That's 70% of our uninsured. Of those, 191,000 were paid through by employers or individuals buying through the Connector. That is 44% was paid not with government subsidies at all, but through business and individuals contributing. That's very important, and your plan will do that. Additionally, since 2003, the number of our employers that provide insurance has gone up 68% to 72%. That is contrary to the entire national states markets. We've proved that by having such a mandate, we will bring in employers who weren't offering it before. And your requirement that looks at the entire payroll, your pay or play that looks at the entire payroll, is more fair because it does not hit low-income employers in a more difficult way. It's based on the size and their ability to pay. It's critical that reform mandates both businesses and individuals to contribute to the cost of insuring everyone, along with government. We must build a safety net for those individuals and small businesses that do not have access now and access to affordable insurance. We want a public plan to provide needed competition and continuity in the market. We believe your draft bill is a great step forward in that, and we support it.